draw your attention to this area here. I want to draw your attention to the proximity of the roots of the centrals to the roots of the canines and how close they are together, right? But how do we approach something like this? There's, the traditional treatment plan that all you guys learned in dental school and then I got re-emphasized in ortho school is you take out the baby teeth, you move the canines back to where they're supposed to be, and you open space for prosthetics. Nowadays, we have even better options than when Jeff and I were in dental school. Now we have implants, right? So, I have to give the original doctor credit. He cautioned them in his informed consent material that there may not be enough space to accommodate implants. But they signed off on the treatment plan, and off we go, right? So what are we going to do? We're going to do that, we're going to do that, we're going to do that. Easy, right? No problem. Well, this is a point in the lecture where I have to teach you something, an orthodontic hard truth. And it has to do with apical treatment planning. That's my phrase, but other people use a different phrase. I just like ATP because I could call it Anthony's treatment plan too. So, what is this about? Moving apices is hard and slow. As a matter of fact, it's complete garbage a millimeter a month. The data is quite clear in the research. Depending on the physiology of the patient, an apex is going to move anywhere from 0.3 to 0.5 millimeters a month. Where the 1 millimeter a month thing comes from is two apices moving towards each other. Could be up to a millimeter. Moving incisal edge and cusp tips, that is easy. That can be really fast, up to 3 millimeters a month, right? So, in my approach to apical treatment planning, what the approach is that we're trying to minimize the amount of apical movement because that's the hardest thing to do and that's going to take the longest amount of time. As a matter of fact, if you have to move an apex a really long distance without the crown moving, that's the hardest treatment in orthodontics. Now, I understand some people here really get that right away, but I want to just do a little demonstration. So, Jeff has volunteered. Come on up, Jeff. We have to bring a chair with you.
I don't know what this is.
No. We're going to take this chair, and we're going to put it here. All right. So imagine this is a tooth, right? This is the crown of the tooth, and this is the apex of the tooth. So I'm going to ask Dr. Meeks first to just move the crown up while keeping the apex in the same spot. See how easy that is? All right, put it back. Now, I'm going to ask Dr. Meeks to translate this chair off the table so it maintains its orientation, but he has to grab it right here. No, so you have to grab it right here, because that's where you're going to put your bracket, on the ground. Go for it. All right, put it back up. Now, ready? All right, I'm going to ask Dr. Meeks to move this chair off the table again, but I want him to move the apex further than the crown. See that? You see how much strain he has to put into that? That's twist, that's called a moment. That is hard to do. Every time we're asking a tooth apex to move, it's really complicated. You use one finger to move the crown. You needed all his strength to move the apex. You get it, right?